My name is Scott Miller, and I will be demonstrating how to insert a Foley catheter into a female patient while using sterile technique. First thing is hand hygiene, and then introduce myself to the patient and tell her that we'll be inserting a Foley catheter to drain the urine from her bladder. I've already removed the kit from its plastic covering, and I'll be using that as my trash. So I'm going to go ahead and open up the first sterile portion of the kit using just the outside 1-inch margins. And then here are my sterile gloves. I'm going to set those off to the side. At this point, I'm going to lift up the patient's gown, and we're going to take the sterile drape and place it shiny side down. And you can see that it's kind of touching the patient's legs, so that will make it, those areas are not sterile, but the middle we want to remain sterile. At this point, I'm going to put on my sterile gloves. And then from this point forward, we don't want our hands to go below our waist or to touch anything that's not sterile. I'm going to take the kit and start to assemble that. Place the fenestrated drape over the patient. And then we're going to use, these are some simulated betadine strips. Those will be used for cleansing the peri area, and throw that away. We'll also be preparing, we're just going to simulate using some lube for the catheter. We're going to put that in there. And then I'm going to take the sterile water for the inflation of the balloon and attach that to the catheter. At this point, I'm going to go ahead and put this into the lubrication. And then we're going to go ahead and clean the patient. So we're going to go on the left side and then throw that away without going over your sterile field. And the right side, throw that away, and then down the center, and throw that away. Then I'm going to take the first couple inches of the catheter and insert that into the urinary meatus and advance that until you see urine start to flow through the catheter. At that point, I'm starting to see urine flow through the catheter, so I'm going to inflate the balloon and watch the patient to see if they're any grimacing or anything like that, which might indicate that the balloon's not fully in the catheter, it's still in the urethra. And we're going to check and make sure the placement's okay and it's not coming back out. And remove the saline. At this part, all of the sterile portion is complete. So we're going to take this, we're going to tape this to the side of the patient's leg and hang the bag below the bladder so that it can properly drain into the collection bag. And that's it. Thanks.